Susa.
Good morning, Eva. How are you? Thank you so much for inviting me over.
We are so delighted to have you and so excited because we were just reminiscing. So back in, I think it was maybe mid-February, I went to visit your organization, and we had a lovely meeting. And this was sort of at the beginning of the pandemic, and nobody knew what was going on. And here we are, 8 months on, and still nobody knows what's going on, except for you guys, because you're such a success story. I have to say that I was honestly really excited when you've agreed to talk to us, because New South Wales, in terms of communication with diverse audiences, is doing something right, I think. And we're all trying. There's no denying that. But what I was hoping you could tell us firstly is a little bit about yourself, so your job. And recently you've taken on a different job and a few other, you're wearing many hats, I guess, and you are very essential in establishing internal and external relationships with MHCS. Is that right? Could you tell us a bit more about that?
Yes, well, I'm Jasusa Halaratni, and and it's a pleasure, Eva. You know, when we first met, we were face to face, and you were flying over to Kansas. I think that was, and you had a meeting, and here we are. Um, Zoom during the new normal meetings. But I think it's important to understand that we're all in this together, as they say. But we always want to make sure that we're able to deliver the messages um, as fast as and as accurate and as culturally and linguistically appropriate as possible. Well, I'm Jess, and I work as the deputy director of the New South Wales Multicultural Health Communication Service. I also have been seconded for a few days at the Ministry of Health, the COVID-19 communications and media teams. So our teams are working closely together to reach the communities, culturally and linguistically diverse communities, as effectively as possible, together, working hand in hand with the services across New South Wales, in partnership and collaboration with the community leaders, with Multicultural New South Wales, and with the other customer service government agencies. And I've been around with Multicultural Health Communication Service for 15 years. I
Wow.
was yes, but I was a journalist prior to that. I was working in SBS as a broadcast journalist, as a radio broadcaster there. And prior to that, I was working with organizations like CNN, ARD, German TV, and some TV stations. So I bring to my role media experience, and I guess what I like to do is be a storyteller,
Mm.
and that's important. Being a storyteller as a journalist, but even as a storyteller in the role I have now. I work with a wonderful team at the Multicultural Health Communication Service who are all experts in their roles. We have a director, Lisa Woodland. We have a communications, marketing manager, which is Michael Kamet, Rajan Manikaraja. He's a systems manager. We have John Alsop, our translation officer, Cecilia George. So I can name them, Glyza Perez and Sam Shen. They're all, we all work together in making sure that we're able to deliver the messages. But being now part of New South Wales Health, we are funded by New South Wales Health.
Hmm.
We're auspiced and hosted by the Southeastern Sydney Local Health District. But during this time, we have more and more, um, at this during this pandemic, has worked even more closer together in making sure that we're developing the right resources. We're targeting the messaging according to the messaging that will be effective for that
Mm.
community. When we did, we targeted, for example, the Lao Temple. We did a pop-up clinic at the Lao Temple. There was a request from one of the health promotion officers, can we do a pop-up clinic there? So we said, okay. There was a request. We went there, and it was a model that we'd like to continue, because what's been done there is those people who would never have gone
Mm.
to a clinic would have gone. And some of the misnomers or miscommunication or information that they're hearing from a lot of other people, saying that, oh, if I get tested positive, I'd have to go to a hotel quarantine, which I have to pay, and
Right.
then it costs me, or I lose my visa. It's not that. It's just getting that information, and you don't know until you go to the community, until you hear that that's what they're hearing. And I
Mm.
think the challenges that we're facing right now is a lot of the communities are listening to information from outside, from
Right.
overseas, from different states, from different. There's a lot of information going out there, but what we're trying to do in New South Wales, and also making sure that the messaging is the relevant information is what is in New South Wales, where
Mm,
you are. So listen to the information. And you're saying, how do we, you're saying that we're a successor. I think it's because we're listening more to the community,
mm,
listening more to the community members and religious leaders in the community, um, medical doctors. Dr. Kerry Chant, the chief health officer, has been having lots of conversations, and also have we just recently held webinars with medical doctors, because it is a partnership. We want to hear
mm.
one issue may not be arising in another community, and so that means that the messaging has to be directed to this community, or this community. um, some communities are testing, they're going for testing, and the messaging may be, how can we ask them to retest again? So it's all about listening, and also respecting each other, and respecting that what the information is coming through is how we can make sure that the messaging that we get out there is accurate, culturally and linguistically accurate.
And of course, Jess, I'm very much admiring of the work you do, because it sounds simple, but it isn't easy, right? So we all want to do the right thing, and I think with the confusion that you spoke of, and just everything coming at us, it's also a matter of disseminating that information in the right way. So yes, you can develop a translation resource, and I know that you've gone sort of grassroots and you've gone to the community leaders and said, listen guys, we all in this together. How do we craft that message but also disseminate it in the right way? Could you maybe cover a little bit of that, and what are some of the successes, some of the challenges around that?
Yes, look, in New South Wales, there's a lot of there's local health districts across the state, and I think that's what make us unique. And there are healthcare interpreters as well. That's in for all the local health districts, and we. In New South Wales Multicultural Health Communication Service, we know that we need to work with the multicultural health services within those local health districts, because they know their community. They
Mm,
know what languages, what emerging community, and what are the gaps there. And so you have to talk to everyone, and consult with everyone. And what we've done is we've worked with the bilingual community educators from the local health districts, and asked them, can you help support us in how we can deliver these messages? And even that, when we did our community videos in multiple languages,
mm,
we had asked in Western Sydney and New South Wales Refugee Health Service and Southwestern Sydney Local Health District and the other health districts. We asked them, what's going on? What are the people
mm,
talking about? What are the issues? So we also needed to address low literacy.
right.
And some people may be able to read in Arabic or other languages, but some people may not. So you had to address how, if it's a video, making sure that it's visual, and the people are from the same community, and that it is for you. It's for the Arabic community. It's for the Vietnamese community. This video is for you, and we tweak the messaging, or we tweak the wording as it would be for a different community, because that
Right.
might not be the same. So, and that's because we're working with actual community members. We're talking to them, and they're talking to their community. And because you worked with them, their video that they develop, they'll be sharing that on their WhatsApp, on their Viber, on their social media, and that's being shared. And they know that, and the community knows, oh, you're kind of part of this, so we can talk to you. The BCEs, they can talk to the BCEs and say, so what else can we do? So as I was talking to Western Australia Health, they asked us, how and also all the other, what else could we do to help each other out? And I think the best thing is you're partnering with the
Mm,
medical doctors. You're partnering. When we ask a medical or a doctor if you could be our champion, we're not just asking them, we use your picture in a social media tile. We're asking them, could you please be the person to do the radio interviews? Could you be the one to share this message to the
mm,
community? And we meet, and we talk, and we chat, and we say, what else? What do you think? What else should we be doing? And yes, we may be calling each other up late at night or early in the morning, um, but we're all answering our phone calls and going, yeah,
Mm,
you look, thanks for that. I think there's more to do. I think maybe we could do this. So it's tweaking everything else and seeing how it could be adjusted or improved so that the messaging and we're all learning. The different thing
right.
is we're all learning. Whoever thought that this could be at the best of times, it's hard to reach communities, but what more during a pandemic when people are where so much information is coming in. But I think the most important thing to remember is that where you are, where you're living, is the information in the news that's available for you. For example, in New South Wales Health, we try to tell our residents, this is what's available for us in New South Wales.
Mm,
Testing is free. Testing is, if you do get infected, or if you did get tested with coronavirus and COVID-19, you will be guided by health professionals, and it will be free. And that's the kind of information, and every day we're meeting and trying to see what kind of messaging and trying to
mm,
see what information is coming there in here and out. And as you said, you can't just translate information immediately. You have to make sure that once it's translated, someone has to check it again, an RT
right.
accredited person has to check that again, and then that has to be checked by the community as well. Is it reading well? Is that going to translate? Is that going to be understood or represented well? Or
Mm,
so
mm,
it's a lot of things, and you try to do your best to get it out as soon as possible. But of course, those are the challenges. But
right.
we try to do our best.
But it sounds to me so there's so much rich information and so much knowledge that you've just passed on to in the last 60 seconds that it's really quite incredible. But I wanted to latch on a couple of things. One is to me, and we work with all kinds of people that work for the government or governmental organizations or community organizations. And what really works, I'll tell you what really works, is someone like you who cares, who genuinely cares, and understands that there's a real conversation. So you can't just continue ticking boxes or not engage the community, because they will tell you what they think. You're right, and they will tell you what they think if they trust you, and if you have had those conversations, and if you have engaged them in a sincere, genuine way, where they're not sort of seen as not, you need to see them as partners. Like everyone is part of a bigger partnership, but and also simplicity of the message, right? Because yes, you can translate everything for everybody and overwhelm people, and they'll still won't be any wiser. So what I wanted to ask you, Jess, is now what drives you? So I've looked, at your LinkedIn profile, at your CV, at your, you know, um, the kinds of things you've done. But what helps you get up every morning knowing that you've already had 50 emails, 20 text messages, people want you in the morning? How do you get up every morning and face the world knowing that it's a challenge every day?
Oh yes, well, look, I think the what I can describe it is there's more to do, and there's more to help out communities to reach. And I think being a migrant myself, and having good English skills, I can say that, being a journalist and speaking English. I grew up in Papua New Guinea, and so I speak English. But coming to a new country is very difficult.
Mm,
If I knew the organizations that I know now, I would have reached out to them. I would have known. But even just navigating the health system with with English skills is pretty hard. What
right.
more with people if you just come with some you don't speak English well, or you're trying to we don't have all the skills to access things, right? Wayfinding, it's very difficult. We all have our ways of learning, and I think I know for a fact from experience that it's difficult, and I want to be able to continue helping people. And I
Mm,
think that's what everyone here is all about. It's what can we do to help people understand and that the message is right. And if you have that core where you're talking to the right people who have that
mm,
same vision of, we want to help the community, we want, it's not just one community, it's all communities. And you hear stories that you just don't want to hear. You just want to
still,
make that all better. um, Remember when I told you that that person thought that if she had COVID, she'd have to go to quarantine and pay that.
right.
people have have challenges. Health is not the most important thing. They want to find jobs. They want to make sure that
Mm.
save their jobs. They have families to feed, and so those messaging and how we can all help them find their way and make it better for them. I think that's what's important.
Mhm.
And the partners that we have, the people who are working on the ground, they, I think, wake up the same way. Where what else can I do to make sure that the community gets the right information in
Mm.
the right way, in the right format, and um, what else can I do to help?
Right, because I think on top of the pandemic, of course, we're also facing the challenge of the way that we communicate changing and very rapidly. So, for myself, I know that I, for example, don't read as much. So
Mhm.
the way that I absorb information is through different ways, so different contexts, videos. That's why we're doing these live sessions, for example. But could you maybe tell us about how you might be overcoming some of the sort of more practical challenges? So you've mentioned a testing station, I guess, that was set up at a temple, yeah? So one for
Yes.
one particular community. Could you maybe tell us a bit more about that?
Yes. So what we were trying to do is, well, we it was a request for the community, and we said, okay, we'll do and the community was so welcome in doing that. And I think, again, that was a partnership, that was a collaboration with the health worker went, and she was there, and we had a health interpreter, and the community center was right there with the church, and we had um, the monks were also got tested, and that showcased that that's the kind of support that the community needed. And that was in a TV news interview as well, where the monk said, This is not about religion, this is about everyone being safe."
Right.
And I guess with that, with the community seeing that their religious and community leaders are supportive of the testing, then they know that they are safe, that then they know that they can go. And I think also checking out with the communities of what's the best time, is this the best location. We went there on a Friday, knowing because they said that on a Friday most of the community go to the temple on a Friday. So that's just an example, but
Mm.
I think that doesn't work for all. Maybe it's better to go to another clinic that's close to to a temple. So I think it's just working with the community, and going and trying to do other alternatives, being creative. And I think that's the word. How can we be more creative in targeting the community? We're thinking maybe with the Greek community or with an Arabic community, maybe it's a different, maybe we'd have to go on a stall to go to one of the events, and do something there where we have a health worker talk about where we can go. I think it's just it's not about ticking boxes, but it's
Mm.
about making a plan. What could work, and seeing how you could be creative in establishing activities that may work for
Mhm.
one community and may work for another, or you'd have to tweak it and change it. And as you said, you have to be creative. It doesn't mean that one video, when we did a video for the Rohingya community, for example, we contacted the New South Wales Refugee Health Service, and they said, don't don't do a fact sheet because they don't read.
Read it.
It's all audio, it's all visual, so you'd have to work with that, and you do that. You can't so say, okay, I'm going to translate this because that's the best thing, you're taking it. And first of all, that fact sheet has to be correct. It has to be easy read, it has to be
Mm.
addressing literacy. That it could be the most complicated thing that even an English speaker, proficient English speaker, can't read, and then you translate that, you've just wasted your time and
Right.
money. So it's all about getting the first, what's the resource, what's the message, how can we make that easier to understand, and then, and that's all the local health districts, all the multicultural health services across New South Wales, and all services are trying to do that, and we're all trying to you know t- learn from each other, I guess, and how we can do that, because we're all experts in different fields, and we all need to talk to each other and how we can work in addressing issues to make them effective.
So really, just what you're describing are tailor-made solutions, and sometimes I find that, well, I wouldn't call it resentment, but people will get confused about service providers, I should say. what is it that I do to make it better. But really, it's about those genuine conversations with the community, learning about them and about ways they communicate, ways they acquire information. And you can't just, like you said, translate a fact sheet, put it on your website and hope that people have read it. But I want to go back to Jess, and that is you. So what you told us, you're very passionate, you're very curious, you want to do the right thing for the community. But what else drives you as a person? I'm really, really interested because I can see, we 1,000 kilometers away, but I can see that passion, and I want to bottle that and give it to the world, because you're just such an amazing advocate of people. So tell us, how do you make that happen? Is that something that you grew up with, or is that something you developed on your own, that passion for the community?
You see, I think, my family's been really, really supportive. I have a great growing up. I had parents who were always supportive. I mean, I have 4 brothers, and they didn't tell me when I was growing up, how you're a girl. They didn't do that. They didn't say, you're a girl, you can't do that. They said, you're a girl, that's why you can do it.
You can do anything.
Yeah, you could do anything. So I had great parents, and my mom said, you can face anyone. Um, whether that's a president or whether that's someone who's helping you, it doesn't matter. And my dad's always been very supportive, and I think having that core value growing up, and the support and the motivation that, we're not rich, we're not we're all helping each other. My father was an expat in Papua New Guinea. He was an engineer there, and we grew up in Papua New Guinea, and we worked knowing different communities and knowing different cultures and growing up like that. Then I have a really supportive husband who's like pushing me and really supportive, and really making sure that he's my strength, that you can do this, and supportive, and I have 2 great children who inspire me to just want to do my best, and the people around me that I work with who have the same passion, who have the same need to help people, and who are experts, who are such talented people, both in especially multicultural health communication service and in the New South Wales communications team. They're all very interested in making sure that we're doing the right thing, and I think that's important. And if you're surrounded by people who want to who are just experts in the field, and who want to help people, and you want to tell their stories, and I think that's important. And for me, I'm a storyteller at heart. I'll always be one. I want to tell stories in every shape or form, whether that be a video, whether that's through a rough fact sheet, that's through a letter. I think that's important. A doctor has a story. You have a story. Thank you so much for doing this, for making sure that people are able to share their story. I think that what drives me is, having a multicultural background, growing up in the Philippines, being born in the Philippines, and then growing up in Papua New Guinea, going back to the Philippines and coming into Australia. I think being a migrant myself many times over makes me understand that, it's really sometimes a challenge to adapt, and a challenge to know your way around, and you need help, and you can seek for that help, and the people who are there to help should be able to understand you, and should be able to know what you need. So I think that's important.
Your words just are very relatable, and that passion does stream through them all the way to Melbourne. I know that we have quite a few questions. I'm going to hand over to Andrea, but I feel so inspired and positive. So rather than looking at the challenges, we always look at how to overcome them. Sounds like that's your approach to everything. And I think if you're able to put yourself into people's shoes, essentially, is what you told us, that gives you that lived knowledge and experience, and then you can sort of know how people might feel and help you do your job better. So over to you, Andrea. What questions do we have?
Thank you, Jess and Eva, for such a great conversation. There's quite a few questions here. There's 2 specifically related to what Jess already mentioned earlier, but maybe you can give us a summary, Jess, for people that joined later today. So first of all, ways, to distribute these translated materials to those, let's say, those people that they don't use social media that often. What other ways we can use to distribute these materials? We know that it's easy to say, well, we're going to distribute this on social media, on WhatsApp, but what are the ways we can find?
Well, thanks, Andrea, for that, and thank you very much for that question. And that's a very important question. We try to find avenues in how to send the information, and that's why we said that we partner up with all the communities, community leaders. So through agencies like Multicultural New South Wales, who are in touch with the community leaders and across the state, they're able to send those information out. And of course, sometimes with the Department of Customer Service, they try to send out posters and the information. But I guess with us, with the Multicultural Health Services working across the local health districts, they have their own multicultural workers on the ground and working with communities, and they're able to share this information. And yes, the new way, as we said, is through social media and how to share that, because a lot of people say that people from multicultural communities are not working using social media, but we are, because we're trying to reach our communities back home, our friends, and we are. So but there is the use of resources like newspapers, so we send out information to them, and they're happy to share that. But as I said, some people are working on the ground and working with communities. Just now, our the bilingual community educator manager in southwestern Sydney is going out to communities and giving posters away, and that's the kind of hard work that people are doing. They're going to go and, oh, look, there's some posters I want to get out there, so I'll just go to the community and do that. And I think that's the kind of support that we have, and that we continue to nourish and nurture, and that we know
It's sort
that.
of like a multi-pronged approach, really, because some things won't work for everybody. But I completely agree with you, is that because social media and internet is really the only way that we can right now keep in touch with our families. Even our older people are learning how to do that, and I think that reach therefore has expanded. But there are sort of methods of actually hands-on getting out there, as you said, with posters or face-to-face communication that are also very effective. And it just depends on the community and who's out there to be able to carry out that work. Andrea, we have a 2 more minutes. One more question, please.
Yes. Also, Jess, how do you deal with information surrounding all this COVID-19 messages? Let's say when you need to be timely and accurate at the same time.
Yes, look, there's we have a great team that makes sure that whatever information and requests that come through, we might want to make sure that, as Eva said, it's relatable, and so it can't be complicated. It has to be as simple as, for example, if we find that some communities are gathering and not physical distancing in communities, we have to say, look, um, we have to say, look, avoid family gatherings if you're unwell. And you have to say those, you have to show a bit of love. I know this is not the time. And understand that when you say it in English, we have to say it as simple as possible, because in English, it's tricky. English, it can be tricky. You can't use acronyms, or you can't because that won't work. It won't translate. So we make sure that whatever information is given to us, we try to make that as easy as possible, and then of course make sure that we make the social tiles or the fact sheets as soon as possible in English, and get that checked through Easy Read, making sure that it also addresses health literacy and low literacy, and then we get that translated. And even when it is translated, we might have to make sure that those are checked again, double checked again.
Jess, you have definitely made our morning.
Oh.
I feel very inspired and very re-energized because, as I said, in Melbourne, we've been, we've been struggling with a lot of things, and all of us are working from home remotely. all of what you've said aligns so much with my own values and values of what Polaron does. So I really sincerely wanted to thank you for spending this time with us, because we do need to know what people such as yourself are doing out there to to change people's lives one person at a time, because really it goes down to that granular level where we look at communities, but we also look at people who are affected, and there's a real cost, a human cost, to people not having information that's easy to understand and accessible. So I think what you've told us today and showed us today is that it's able to be done. You just have to be interested, curious, engaged, and want to do the right thing, and be respectful. So I'll hand over to you for just a few last words, but thank you so much, sincerely, for your time and your expertise. I will be back in Sydney. I don't know when, but I will come again and hassle you for a coffee. But in the meantime, over to you, and thank you so very much.
Well, thank you so much, Eva and Andrea, and I really appreciate you inviting me and being able to showcase the work that the New South Wales Multicultural Health Communication Service has done. Our team is incredible, and also the work that we're doing with the Ministry of Health and the COVID-19 team here is really working hard to make sure that we together, MHCS and New South Wales Health, are able to develop resources, again, as appropriate as possible, which is cultural as well as linguistically appropriate. But what's important to remember is that let's respect all communities, all diversity, and respect the workers that and the teams that we're working with. Everyone, we're all experts in the field, but we're all learning from each other. Listening is important, and just be honest. That's maybe I don't know this, and how can I understand the situation? We're all learning. This is not at all a normal situation. This pandemic, and we don't know when it's going to end. And now the easing of restrictions, how even that, what if it's easing up? What do you do? What kind of just because it's easing up doesn't mean you can't follow the basic COVID-19 rules of being safe and washing your hands. And I think I just want to say thank you again, and also to everyone. Let's keep safe and take care, and respect. Respect is important, and that just says a lot. Respecting each community and respecting each other.
And I think that's a wonderful message to end our quick session on. And thank you. Say hello to everybody in your team. Best of luck. And thank you once again for sharing all of what you've said, because it really resonated with everyone, I think, that's listened. There's so many other questions, Jess. I'm so sorry that we weren't able to ask them, but I'm sure you won't mind if people reach out to you, particularly if you are struggling with how to present information, how to communicate with people that you're working with. There are lots of on multicultural health communication services and New South Wales government website. There are lots of very, very good resources. Look them up. And there's lots to be inspired by. And thank you so much once again. And say hi to everyone there at the office.
Thank you so much, Eva, really Andrea. Thank you.
Have a great day.
Have a good morning.
Thank you, guys.
Bye.
Bye-bye.